Thank you. Thank you very much, and good afternoon, everyone. Welcome to our 16th Coronavirus Telephone Town Hall. I'm Senator Steve Glazer, and today we will be discussing the extension of the Bay Area's stay-at-home order and some changes in the new order that will, in some cases, relax restrictions in a number of ways. The new order will take effect this coming Monday, May 4th. But today is day 45, by my count, of the Bay Area's shelter-in-place. I know it has been challenging for everyone, and it continues to be, but it's so important that we not just bend the curve, but flatten the curve for this very dangerous virus. I always like to start off with some of the numbers around the globe and locally. Unfortunately, in the world, there's 3,300,000 cases identified. 233,636 people have died. And, of course, unfortunately, America is leading those numbers. We have over 1 million people in the United States now who have the virus, at least through testing, has been detected. Over 63,000 people have died. Today alone, over 2,105 people have passed away. Here in Contra Costa County, we have 862 cases identified. 25 people have died. Alameda County, 1,568 cases. 57 people have passed away. And I'm sure there is enormous grief for all those family members for what has happened to a loved one. As you know, if you have been a part of these calls in the past, we take questions from listeners. We've already received over 115 questions for our guests today, maybe a new record. And so we're going to do our best to get through as many of those as we can. And also for those who have been following this issue closely, you know that on my website you can go back and listen to any of the previous 15 coronavirus town halls. We've talked earlier this week about nursing homes and the explosion of cases in nursing homes. We've had discussions about the unemployed and what they can do to get benefits, the effect on small business. We've had a very good conversation about distance learning for all those parents out there that are struggling and are challenged with kids at home. Some good advice about distance learning. Certainly one of our most popular town halls, I've been 2 of them on the subject of the grocery stores and the supply chain and how they're doing. We've had wonderful discussions about the issue of pets and the coronavirus, as well as coping skills. So those resources, plus many more, are on my webpage. I encourage you to check it out, and hopefully that can be helpful to you. But my 2 guests today are going to give us more details and help us understand the public rationale behind the new orders that determine what we can do within our shelter-in-place. We'll also discuss 5 specific benchmarks that the county will be using to determine when we can take the next steps to ease some of the restrictions that we're currently under. So first, let me introduce our guests. Dr. Chris Farnantano is the Chief Health Officer of Contra Costa County. Dr. Farnantano is a graduate of Duke Medical School and is a board-certified family physician and HIV specialist. Dr. Farnantano, you've had many different roles here in Contra Costa Health. I understand you were Assistant Residency Director. You were the Family Medicine Department Chair and Ambulatory Care Medical Director for the health system's 11 health centers that provide over 500,000 visits a year. Quite a big responsibility there. And I know that previously you were a fellow with the National Association of Public Hospitals and Health Systems. Dr. Farnantano, thank you very much for being a part of our conversation today.
Thank you, Senator. Glad to be here.
The second guest is someone that I've known for quite a while, and many of you probably have had a chance to see and visit with, and that's our Supervisor, Candace Anderson. She was elected to the county Contra Costa County Board of Supervisors in 2012. She's currently serving as chair of the Board of Supervisors. Supervisor Anderson, this is your second go-around as chair. Is that right, or more?
Yes, it is.
Second go-around as chair.
Second time as chair.
I know you were previously on the Danville Town Council from 2003 to 2012. That's where we got to know each other, serving 2 terms as mayor, and that you are a licensed to practice law in California and Hawaii. and I know that you have a big family with many kids. Are any of them still at home now with you?
I'm only sheltering in home, and so she's working from home. The last of the children, who's not yet married, has a great job down in Silicon Valley, but as her roommates all dispersed, she uses one room in our house for sleeping and the other to work.
There you go. Well, I have a daughter at home, too, for similar circumstances. So Supervisor Anderson, let me start with you. We're going to get into the details about the new order, and how the future will change. But give us a 10,000-foot view of the situation in the county. Hospitals, have they been overrun? Are they under capacity? Homeless shelters, are we in good shape, bad shape? We've talked about the nursing home hotspots that have kind of broken out. Can you give us some sense of how are we doing as a county?
We're doing very, very well under the circumstances. And even as you were providing numbers, I would say these get updated every day. And so for those of you who haven't been to our website, go to coronavirus.cchealth.org. And so today we actually had 13 new cases, which brought us up to 891 confirmed cases in our county, and 2 more deaths. So very, very tragically, we've seen families lose family members, who are up to 27 deaths in our county. We have on the website a great dashboard that can tell you our hospitalization. Right now, we do have 27 people who are hospitalized, but we're also able to track what's so significant to each of us, which is the ICU beds. And so in our county, that's all hospitals combined. Right now, we have 228 ICU beds that are available. Of those, currently only 98 are being used for all purposes, not just for COVID purposes, but for all purposes, which shows we're only about a third use of our ICU beds. The other thing that we're looking at is our ventilator utilization. Unfortunately, we've got right now about quite a few ventilators, because we worked very quickly to get them. We have 285 ventilators available, but only 43 are being utilized. So from a hospital standpoint, we're in great shape. From a homeless care standpoint, we're in very good shape because of and I do a shout out to Lavana Martin, who is our homeless director, who very proactively worked with each of our homeless shelters to ensure that we removed all of our clients before we had a spread. So we've not had anyone in our homeless shelters come down with the virus to date. And currently we have 241 hotel rooms occupied by homeless individuals and families. And we don't just give them a key to a hotel room. We have supportive services so that they can be successful while they're in that situation. And so from those standpoints, we're doing well. We do have 2 sites already up, ready to go should we need additional capacity, and that's at the Craneway Pavilion as well as at our county fairgrounds. And so those are ready to, if we see a surge right now, as I know Dr. Farnetano is going to talk about, we're seeing a fairly level number of cases. We're not seeing the same dramatic rise that we were seeing very early on. And we're doing a really good job of increasing testing. And that's something that Dr. Farnetano is going to be talking about, just how we really need to, in order to loosen up our regulations, our restrictions, we need more testing. And so we've been able to, last week, open 4 test sites, free testing. You need to at least be symptomatic, but there is a number that people call if they are feeling symptoms so that they can be tested. And we want to ensure that anyone who is symptomatic is getting tested either by their own medical provider or at one of our test sites. And we are adding additional test sites, both county as well as the state. We want to thank them for providing us with some additional testing sites, funding those, helping staff those as well. And then we're providing things like emergency child care programs. And so partnering with Cocoa Kids, those who are essential workers, which is defined by the state, can be medical staff, first responders, grocery store workers. Those all fall in that category. We do have free child care available. And then, of course, with the new order, which, again, Dr. Farnetano will be talking about, we're opening up some ability of preschools, regular schools, school camps to provide programs this summer so that parents can get back to work when they have those important jobs that are so critical. And one thing too, I do want to point out, because this comes up often, is who's making these orders. And interestingly, Board of Supervisors, we do not weigh in on these orders in formal action. We do not approve them. We don't get to vote on them. Under our state California Health and Safety Code, there are two provisions that allow, during either a state of emergency or in a time when we have a pandemic of this nature, our health officers are the ones who make these orders, as well as, of course, the governor, who also is making orders. And so I think that gives you sort of a global view of where the orders come from. And then we on the Board of Supervisors, through regular briefings, through regular conversations, input with our health officer, provide our opinions. And we are, in fact, starting next Thursday, we'll be having our first ad hoc COVID-related issues Board of Supervisors meeting. The two of us, Supervisor Mitchoff and myself, are sitting on that to really listen to businesses, to other activities that want to get back doing what they're doing, might believe they can do so safely under the parameters of these guidelines, under the parameters of these orders that we have in place. And so we're going to be looking at those as well.
Very good. Well, we're gonna get to those orders now if we can. And let me thank you, Supervisor Anderson, for all your good work. It's a lot of stressful circumstances, I know, for you and for your board members, and I think you're doing a very good job. Dr. Farnantano, what a great opening from your Supervisor Anderson, that you're the real decision maker here, and for good or for bad. But I actually think it's been for really good. I know there's a lot of frustration out there, but you and your fellow health officers in the other counties working together, I think, has been very smart, because we know we're all one big Bay Area family here. And so we heard from Supervisor Anderson that things seem to be going very well. Our hospital usage is way down, that we have a lot of ventilators. The homeless population has been well taken care of, with added shelters being provided. Testing is improving. So a lot of that speaks to, okay, now where do we go from here? And the order that you announced yesterday does provide some level of relaxation, but let's have you first go through the changes from the shelter in place today and what it will be like on Monday when the new order goes into effect.
Thank you, Senator. And many folks, including the governor, have talked about multiple phases of getting the economy back going and loosening up on these restrictions. And we're really kind of considering, myself and my fellow Bay Area health officers across the Bay region, that this is sort of going from a phase 1 to a phase 1.5. So there's some changes that are loosening up some of the restrictions, but we have to do those in a very stepwise, careful way, and to make sure that those changes don't lead to a large surge. We are doing much better. Our cases in mid-March were doubling every 4 or 5 days. Now they're doubling every 23 days. As Supervisor Anderson mentioned, our hospital numbers are flat or decreasing across the Bay. So it's allowed us to loosen up to some degree on these restrictions. So under the new orders, all construction projects will be allowed to resume as long as the projects comply with certain safety protocols that are included in the order. All real estate transactions will now be able to resume, but with continued restrictions on open houses and limits on in-person viewings that have to follow social distancing rules. There are expansions of the guidelines around child care to include other child educational activities that schools may want to put on, or summer camp programs may want to put on. They have to be within fixed, stable groups of 12 children or less, and the teachers or adult supervisors have to be the same, so there's not mixing of groups. And then certain outdoor businesses can also begin operating again. So that's including nurseries and landscapers and gardeners and other businesses that traditionally perform outdoor services. That does not include restaurants and cafes or bars, because that requires a lot more social interaction than some of these other businesses. So that will have to wait for future step. Also, residential moves are allowed, and certain shared outdoor recreational facilities that don't involve a lot of use of shared equipment or close contact. For example, golf and tennis is allowed under the order, but pools and dog parks and basketball courts where there's a lot of close physical contact, it's hard to social distance during those activities. Those will not be allowed.
Well, so there's some relaxation. You called it 1.5, but it has left people with a lot of different questions, and many of you have written in with those questions that I want to ask Dr. Farnantano to give his perspective on. And let me try to group them in categories, but certainly in the area of recreation, I've gotten a lot of questions on tennis, golf, and swimming, and why don't we take them first. There's swimming pools on apartment buildings. There's swimming pools in swim clubs, public and private, and there's swimming in camps as well. Mm-hmm. And there's a lot of people who have written in confused about what they can or cannot do with swimming. Let me mention a couple of them. Cheryl says, my apartment building has a common area with a swimming pool. If we practice social distancing under this new stay-at-home order, can we use the pool? What would you say to Cheryl? Apartment building, and they have a common area with a swimming pool.
We're learning more and more about how this virus is transmitted, and we're learning now that even just speaking or breathing can transmit the virus, and breathing during exercise may be able to transmit the virus even beyond a 6-foot radius that we're talking about, people maintaining the 6-foot radius. And for those reasons, pools that are sharing use between households, say in an apartment complex, or a public pool where people are coming from multiple households, that is not allowed on this order because that provides the opportunity. Even, for example, if you were in separate lanes swimming, you're breathing above the water, and there's a risk of transmission. On the other hand, a personal backyard pool where that family is the only one using that pool, or again, in a summer camp where there's a fixed, stable group of 12, they're kind of treated sort of like a household, could use a pool for the purpose of that camp as long as they're not that pool is not being used for other groups at the same time.
So some people have written in, this is an interesting inquiry from a physician, Lisa. She says that her standard of care recommends swimming because it's one of the best forms of exercise for middle-aged and older adults. She says that swimming in lanes with social distancing in a chlorinated pool that kills viruses and bacteria, and as you know, many swimmers wear masks. Why is that, which is such a healthy endeavor, if you have lanes between you, why would that not be okay?
Yeah, and it is really a balancing of risks. And so there's a lot of exercise that's really great and healthy for people, but when that exercise brings people in close contact. So even though the water has got chlorine in it, and that certainly kills viruses, but people are breathing above the water. People are using shared locker rooms, changing rooms. People are getting in and out of the water. They're passing each other by one lane to another and breathing above the water. So it's it's a matter of balancing the risk. We're at a very early stage of loosening these things up. As hopefully things continue to improve, we'll be able to loosen up even further. But keep in mind, even Los Angeles last week, their cases doubled in a little more than a week. So there's that virus is still out there, and so we have to proceed cautiously, step by step, to make sure we don't see a sudden surge in cases.
We're talking to Dr. Farnantano, who's the public health officer, Contra Costa County. Let me ask you one more pool question because there's been so many. We do have a lot of private community pools, and many of them don't even open until the end of May, and they have a wonderful swim season through the summer. Any guidance you would give them about the prospects that competitive swimming or even recreational swimming might be something that is still possible as we finish the spring?
Well, again, these orders are step by step. They've been extended 3 to 4 weeks at a time, and you know, we hope to go to further loosening in June and July, as long as the trends are encouraging and the number of cases and hospitalizations go down, and as we scale up our testing and management system to be able to better contain this virus.
Hunter writes in and asks about tennis. It seemed like under the old ordinance that will go out of existence Sunday night, tennis was not allowed. But it seems like under the new order, that since that's not shared, is the tennis balls considered shared equipment? And where is tennis on in the new order?
The idea on outdoor recreation is that we're looking at things that are not necessarily no risk, but very, very low risk. And so we're looking at things in which social distancing can be maintained and there is not a lot of shared equipment. So other than a ball, you can play tennis without sharing any equipment, and you can even figure out ways to play tennis where you maybe play with a couple different tennis balls and nobody touches the same ball. That's as opposed to something like basketball, where you're touching that basketball over and over again. You're having close physical contact. It's a contact sport. So basketball is not allowed, whereas as singles tennis would be. But I would caution against doubles tennis, because doubles tennis is hard to maintain that 6-foot distance.
Okay, so basketball, no. Tennis, okay. Singles, better. Doubles, probably not, because of the physical distancing requirement. How about hiking? Now, Jacob writes in and says, when going out for a walk, run, or bike ride, I've read that COVID-19 droplets found in air particles of infected people. Do you recommend that those who go out on walks, runs, bike rides wear a mask? Is there some danger, and is there any spacing requirements in that type of activity?
It is recommended to bring a mask when you're out hiking, in case you run into other people. If you're far, far away from other people who aren't in your family, you don't need to wear it. But there is more evidence showing that these virus particles can travel, especially if someone's exercising, hiking up a hill and breathing strenuously, or riding a bike or running, that in what we call the slipstream, in the path directly behind that person, the virus may travel more than 6 feet. So if you're hiking, and it's good to not hike directly behind somebody who's not in your family. If you're running or riding a bike, it's good to not be directly right behind that person. Either give some distance or be further on the side, so you're not in what they call the slipstream.
All right, and then Hannah, you had a similar question. I think that answers it. Let's go to golf. Clarification as to whether public or private golf courses are now open for members to play at if they maintain the physical distancing requirements. What does the new order say about golf, and how does that work in conjunction with the state minimums? Is it okay now?
So the local order does allow golf. It is an activity where you can do social distancing, where you don't have to share equipment. The state order is not real clear on this point, and so our interpretation is that golf is allowed under the state order, but we do welcome more clarification from the state on that. It is true that both the state order and the local order apply, and whichever is the more restrictive on any one point does apply. But our understanding at this point is golf is allowed to proceed.
All right, that answers Whitney's question with a caveat that there could still be some pushback from the state on that. But I have heard that golf has been allowed in Sacramento County even before these new orders have been issued, and the state has not pushed back there. So hopefully that's optimism on the golf side. Although Sandra writes in and she says, we are a couple in our 70s who love golf. We're thrilled to see that golf courses will be allowed to open, but we heard that golfers must walk the course and not be allowed to rent motorized golf carts. Is that true? And if it is true, it seems to be unfair to the elderly who want to get the exercise of walking or playing golf, but now can't use a cart. What would you say to Sandra?
The Golfing Association has put forth certain guidelines for golf courses to operate safely. There's no specific prohibition on golf carts in the health officer order, but there may be some particular rules that individual courses are following that might be in accordance with their industry guidelines. But I can't speak to the specific details of their guidelines.
Okay. Let's switch subjects now to dog parks. Deborah writes in, will the easing of the restrictions allow skateboard parks and dog parks to be opened? They don't involve shared equipment or physical contact. What would you say to Deborah?
So there's new research showing that pets may actually transmit coronavirus, either between pets or possibly between pets and humans. And for that reason, the CDC recommends against any unnecessary mixing of dogs and other pets between households. So that's one reason that dog parks are not allowed, as well as the fact that often dog parks are a place where people congregate in a small area, and it's harder to social distance.
Let's switch subjects again and deal with construction, remodeling. Tamara writes in, does the easing of restrictions on construction allow the resumption of interior remodeling and renovation projects with contractors being able to enter homes? That's Tamara.
It does allow all forms of construction as long as the construction company follows the social distancing protocols that are specific for construction that are attached to the order. There's one protocol for large companies and another protocol for small businesses. But that would include home remodels. There's social distancing requirements in the order that try to protect the workers as well as the occupants of the house getting the remodel.
So Julie writes in regard to construction employees, one of whom is her husband. He is a shader installer for a local company. He goes and installs from house to house. How can he be sure he's being protected from COVID-19, she asks?
Well, the construction protocols, if they're followed, really include a lot of steps to make sure that those workers are protected. So they involve all the workers wearing masks, prohibiting gatherings of any size, prohibiting the workers from carpooling together to the work site, controlling kind of choke points in high-risk areas where workers might have to work together closer than 6 feet to try to minimize those. Daily screening of workers for symptoms, fever and cough and other symptoms, so make sure nobody with symptoms comes on the work site. So there's a series of steps to really try to protect the health and safety of those construction workers.
Very good. And this may be a question for Supervisor Anderson. Bob writes in and asks, will city and county planning departments continue to provide approvals now for new construction projects? Supervisor Anderson, is the county planning department open? Are they processing applications old and new now, or will they be?
They are, but it is going, meaning they are as of Monday once we start, but it's all going to be virtual, 99%. And so there's going to be a whole online submission of plans, whole online request for plan checks, request for building inspectors to come out. And in those limited situations where there needs to be a face-to-face meeting, we have already redone the lobby of our conservation and development offices to have a sort of a giant sneeze guard, so to speak, plexiglass that will divide a planner from meeting with somebody, but those are only going to be by appointment. And so on the county's website in our planning department, all of that information will be up there, so there aren't any walk-in appointments. And so those roofers, fencers, other people who are used to just walking in to get a permit day of, they're going to need to change their protocols because we really are trying to limit the interaction of our staff with those new contractors, construction projects that are going forward.
And Supervisor, would you suggest on the city level to contact the local city to see what allowances there would be there? Our hope would be that, given the county ordinance that allows construction, that permits and approvals, that process would be able to move forward. But each city will have to decide for themselves, although I expect, given our housing challenges that we're facing in the region, that they'll all work hard to be able to provide for that.
They have. They've been moving. Many cities have been moving toward online permitting for many years, online scheduling and plan checks for many years. So I think it's going to be a very smooth transition. All of our city managers are regularly meeting with our health officers. They're meeting with our county administrator, and there's certainly a desire to get as many people out and working again, getting as many construction projects up and running as we safely can. So absolutely, I expect cooperation with our cities.
Very good. Let's bring Dr. Farnantino back in. Carol writes in, she says, I'm a senior who would like to know if it's safe for my house cleaner to resume cleaning if we both wear masks. She wears gloves and we stay appropriate distances apart. Carol asking that question, what would you tell her?
So indoor services, personal services, as well as indoor home services are not allowed by this order. And I'd also like to make the point that for our seniors who are the most vulnerable to this virus, with the highest mortality rates, that we really encourage them, even if activities are allowed in this order, to really try to stay at home and reduce your contact with other individuals outside of your home as much as possible, because the seniors are the ones we worried about the most, that we want to protect the most.
Okay, we're going to shift in a moment to talk about the future and what it's going to provide in terms of relaxation of some of these standards that don't allow house cleaners and others. But there's so many questions on the adjustments to the order. I'd like to go through a few more of those. Dale writes in, and she says, will grandparents be allowed to babysit their grandchild at their grandchild's house?
So child care is allowed for essential workers and those other allowed workers of allowed businesses in the order, and that includes folks who are working for essential businesses from home. And so if their a grandparent is providing child care for a parent that is working in one of those businesses, that would certainly be allowed. Again, that covers formal child care as well as the informal kind of family-provided child care. Again, we do caution that seniors take extra precautions because of the higher risk they are at.
Okay, and Matthew says there's been conflicting information regarding the opening of preschools. We've heard different reports about preschools opening or not. The governor talked about it a little bit today. Again, can you be clear on preschools? Are they allowed if they are in smaller cohorts, if they're only serving essential workers, or how would you describe preschools? And I guess some would say, is that child care? Is that early learning? And it may be an issue of definitions here, but can you provide any insight on the issue of, in this case, preschools?
Yes, so the latest order expands the definition of allowable child care to also include educational, recreational institutions or programs or camps that are providing care or supervision to children of all ages. So it's preschools would certainly fall within that. So as long as they are in stable groups of 12 or fewer children, which means that there's 12 or fewer children, they're the same children each day after day, don't change from group to another, and the adult supervision is also staying within the same group, those would then be allowed to go forward. And it's really care that is for the owners and employees and workers of essential and allowed businesses. Okay.
We've got a couple questions on real estate, and there was some changes, as you identified in the ordinance, regarding real estate. Melanie writes in, and she says, can they show property? Is that okay to have people come and look at a house for sale now under the new guidelines?
Under the new guidelines, they are able to show properties. The only restriction is that open houses are not allowed, but individual by appointment showing of houses, if the residents of the house are not present at the time of the showing, so that social distancing can be maintained.
Okay, and Joe has a similar question, which I think you've answered. He asked about their ability to show a property, and the answer would be yes, if it's done agent to a potential buyer without the seller present, and obviously not with an open house, as you have described.
Correct.
Susie writes in, my daughter-in-law's father died in February. We're preparing his house to sell before the stay-at-home order went into effect. His house is in another county. Can we go to his house to prepare to put that house on the market? So that's that's a compound question. If it was here, it might be one thing, but now it's about traveling to another county and what might be allowed within that county. So that's Susie asking that question.
Yeah, that is allowed to necessary travel for the preparation around that sale or that potential move is allowed under the order.
Okay. Tom writes in, and now we're moving away from specific allowances or not under the order, and he says, I would like to know if the shelter in place is really saving lives or just delaying deaths with a flattened curve. If just delaying deaths, in the meantime, people are not working, businesses are failing, and tax revenues are getting hit very hard. Doctor, what would you say to Tom? And this is an angst that I'm certainly feeling from a lot of people out there that feel that we've made progress or that flattening the curve may only be a temporary circumstance, and at some point we're all going to get infected, and are we delaying that inevitability?
Large part what we're doing is we're really buying time. When back in early March, and when cases were doubling every 4 or 5 days, we were looking at the prospect of a surge that would overwhelm our hospitals within a few weeks. And the more time we buy, the more better prepared we are. So we've acquired extra ventilators. We've developed protocols. Our hospitals are much safer. We are better staffed with personal protective equipment than we were. So there's less healthcare workers getting sick. We're having more testing so to identify folks who can spread the virus. We're also buying time for better treatments. There's no specific drug available yet, but the doctors who are treating the coronavirus, COVID-19, are learning better about techniques of managing patients with blood thinners and special ventilator protocols to help decrease complications, and that's making a difference on the mortality rate. We're hearing things about promising advances in drug treatments that may be available soon. There's some encouraging news about potential vaccine development. So what we're doing is buying time. So even a few months gives us time for our hospitals to be prepared and time to our treatments to get better so that we can decrease the mortality rate. So it's not just delaying the death, but it's actually preventing death.
Okay, appreciate that insight. And I know you're speaking to many people out there who are wondering, are we on the right course? Is this the best way that we can handle this terrible virus? I want to shift to the future, but I do have a bunch of dentists who have written in, so I want to give them the chance for their question. Mm-hmm. They want to know whether the new health order allows them to see patients again. If it's not a life-saving kind of treatment in the dental chair, can dentists and can hygienists, can they provide routine dental services?
So the local health orders have not prevented routine medical care, including dental care. There was directives from the governor to defer and suspend routine health care at the start of this epidemic, but the state has now put forward guidelines on how healthcare practices, including dental offices, can begin safely resuming some of that routine care. We are concerned as this emergency goes forward that people have put off some of their routine care, some because of fear of coming into a healthcare setting and fear of getting exposed to the virus, some because the concern that we wanted to focus the attention on the healthcare system getting ready, and there was a shortage of personal protective equipment like masks and gowns. But now that the hospitals and medical facilities have had an opportunity to really prepare, I tell my patients that it's safer to go to the doctor's office now than it is even to the grocery store, because they're doing screening of people coming in for symptoms. Everybody's wearing masks. There's lots of social distancing in the waiting room. There's doing a lot of virtual care as well. So we now want to start step by step getting back to a lot of that routine care, whether it's a dental cleaning or getting your eyes checked or getting childhood vaccines or a mammogram. We want to start getting back to those things we've kind of put off while the health system was scrambling to get prepared for this virus.
Okay, well, a lot of people will be happy to hear that guidance, no less than the dentists and the hygienists who have been out of work for quite a while now. Well, let's shift now, and the health officers that you are a part of have talked about indicators that will allow the Bay Area to open up even more than the order that goes into effect on Monday would do. Can you speak to, I think you've indicated that there are 5 indicators that you're going to watch now going forward. Can you kind of give us a summary of what those are, and then we'll go through them, and I know I have a number of questions that people have written in about them.
Sure. Just real briefly, the 5 are whether the total number of cases in the community are flat or decreasing over time, whether the number of hospitalized patients with COVID-19 is flat or decreasing, whether there's an adequate supply of personal protective equipment for all healthcare workers, and whether we are meeting our goals for the need for testing so we can test all symptomatic patients as well as those patients in vulnerable populations such as nursing home workers and nursing home residents and first responders, and whether we have the capacity to investigate all cases, trace all of their contacts, and can isolate all those who test positive and quarantine their close contacts who've been exposed.
So these indicators, is there going to be a place that people can go to see because I'm going to ask you about progress on each of these now, but is there a place where there's transparency so we can all track our progress in these indicators?
Yeah, so most of the Bay Area counties, including Contra Costa, have a data dashboard. Ours is at cchealth.org/coronavirus. And we've got many of these metrics already built out, the number of cases per day, the number of hospitalized patients, and number of tests performed each day. And we're working on putting up the other metrics as well. And we're working actually across the Bay Area with our data scientists to come up with a Bay Area-wide dashboard that we can kind of look across the whole Bay and see how these numbers are going. Because we are one human ecosystem across the Bay with so much travel and interaction with people commuting for jobs that we really need to look at this in a region.
So there's obviously a lot of blood, sweat, and tears that has gone into this sheltering in place, and I think all of us would like to be able to monitor our progress, not be surprised when if we're not making progress, and of course hopeful as we are making progress. Is it fair for me to ask you questions specifically about Contra Costa and each of these 5 indicators, or do you feel it's not fair, it should be looked at as a Bay Area, as a region?
No, I mean, we will be looking at it together as a region, but each county is also, looking at it individually. So I can certainly speak to that.
Well, let's go that way then. So the first test is the total number of cases flat or decreasing, and total number of hospitalized patients with COVID-19 flat or decreasing. What's the answer right now in Contra Costa County?
So the cases have been flat for the last couple of weeks, and our hospital patients with COVID-19 have been decreasing. We were at between 40 and 50 patients a day 2 weeks ago. Then we dropped into the 30s last week, and this week we're running between 20 and 30 patients in the hospital.
Okay, so very encouraging news on indicator number 1. Indicator number 2 was that we have sufficient hospital capacity to meet the needs of our residents. Supervisor Anderson at the start talked about our hospital capacity. It sounded like we were in really good shape on indicator 2. What would you say?
Yeah, so that indicator is we want to have at least less than half of our hospital beds and less than half of our ICU beds occupied with coronavirus patients, because we need the other half for all the other medical care, elective surgeries and heart attacks and strokes and cancer treatment and everything else. And we are staying at this point below that 50% threshold.
Okay, so check on indicator number 2. Indicator number 3 was sufficient tests are being conducted each day to detect COVID-19. And Supervisor Anderson talked about the 4 new testing sites that the county has set up. So we all know, I think, and I haven't asked you this directly, but at least my opinion is one of the big failures on this whole coronavirus has been the failure of testing to identify community spread and to give us the data that gives us a lot more accurate information. So I know it's been a work in progress. It's not the county's fault, but that's the circumstance that you're in. And you do identify it as an important indicator going forward. How are we doing on testing now, and where do we need to be?
Like you said, we really were in some ways flying blind in the months of February and March because we just didn't have adequate testing. Right now, we think most systems have the ability to test any patient with symptoms. We encourage people with symptoms to seek out testing, either through your own provider or through the county-run testing sites. But we still want to do even more. So our goal is to get about 2,100 tests a day throughout Contra Costa County, and we're between 300 and 400 tests a day. So we really got to scale it up about 5 times where we're at now. And that will allow us not only to test everyone with symptoms, but to test asymptomatic close contacts of people. So if someone in your family gets test positive, you've been with them, you want to get tested to see if you're positive even before you get symptoms. We want to test healthcare workers who are working with our frail elderly, like in nursing homes or in hospitals, so we can protect those frail elderly by picking up early people who might have tested positive before they pass on the infection.
Okay, so we have a work in progress there that we can track. And I know the governor is very committed to increasing testing, and he's been working very hard on that. But we have more to do there. Indicator number 4, we have sufficient case investigations, contact tracing, isolation, and quarantine capacity. And that's a new one. I know that's something that you have done, but now you're talking about doing it potentially on a big scale. So where are we in the county of Contra Costa on that?
We still have ways to go. We've scaled up our workforce. I mean, before this epidemic, we had about a dozen staff who were dealing with measles outbreak investigations or tuberculosis or those type of things, and those are very, very small numbers. And now their work has really grown, and so now we've scaled that group up to over 100 staff, but we need to actually scale it up even more so that we can actually not only reach all the cases, which we're doing, but actually make personal contact with all of their contacts and make sure that they understand how to isolate, that they have a place to isolate or quarantine themselves, and also that we can get all those contacts, give them instructions and make sure that they're getting tested as well.
Now, the county health officers have not made this some elusive target. They've been very clear, and you have been very clear about the standard that must be met to achieve indicator number 4. You said we have to reach at least 90% of the cases and identify their contacts. We have to ensure that 90% of those cases can safely isolate. And so those are very clear standards. It's not meant to be nebulous here. That's a high bar, and one that requires a capacity expansion in Contra Costa of great proportions. So I know that Supervisor Anderson, you and your colleagues have got to be committed, and I know you are, to getting the resources to the health department to do this tracking and tracing in order for this indicator to be accomplished.
Absolutely, you're correct. It's one of our highest priorities, and we have a wonderful emergency operations center that just spends much of their day, one unit of it, just in logistics, trying to get more and more supplies, because one of the biggest challenges has been having sufficient test kits, and that ability to scale up is so important for us to do.
Very good. And the last indicator is that we need at least a 30-day supply of personal protective equipment. We refer to that as PPE, available for all healthcare providers. Dr. Farnantano, how are we doing on our supply? What is our current supply that these facilities have today?
We're getting better, but a lot of facilities are still working off of a 7 or 14-day supply. They're still having challenges getting their supplies from their usual vendors, their usual supply chain. So they're coming to our emergency operations center and putting requests. We're reaching up to the state, and the state is supplying us with some equipment. But often, they're requesting a 30-day supply, and we may have 7 days to give them. So we're still not where we can totally feel comfortable that we can breathe deeply, that we've really got enough of this personal protective equipment on hand. It is getting better though, and that's encouraging.
That is encouraging, and I want to just underscore that hearing that you're going to put this matrix of these indicators and how we're doing, that transparency, I think, will bring a lot of confidence and trust from our community, that they don't want it to seem like it's the back room making these decisions. You and your public health officers, I think, have done a great job of putting out a very clear roadmap of how we're going to get through this. And I think there's a lot of encouragement about that. Let me go to some questions. Marilyn writes in, she says, why is the number of positive cases being used as an indicator for reopening? Won't the number of positive cases increase as the number of tests completed happens, I guess, over the next 2 months? She says flattening or decreasing the number of cases seems impossible as testing is tripled or more. What would you say to Marilyn?
Well, once we really are doing that vigorous number of tests per day, we're hoping that at that point we are actually, identifying most cases in the county. So she does have a very good point that, before, when we weren't doing much testing, that as we increase the testing, we're finding more cases. But we're hoping that once we have sufficient testing in place, we're going to see changes in the number going up or down, really truly reflecting the changes in the spread of the virus. We're also going to be looking at things like the percent of patients that test positive. So if that percentage is really low, say under 5%, we know that we're doing really enough testing to be not missing a lot of cases. But if that percentage starts shooting up really high, that tells us that the cases are either surging or we're just not doing enough testing.
So let me ask specifically about testing. John writes in, is testing coordinated or prioritized for essential personnel today? If you're working in those places, can you get a test today even without a doctor's note?
So we are prioritizing now rapid tests for high-risk individuals. So rapid tests that are run with a result within 24 hours are prioritized to healthcare workers, people who are in the hospital, sick enough to be in the hospital, people who work in sensitive settings like nursing homes or group living situations. But anyone with symptoms can get a test through one of our county testing sites. Those lower priority groups, they're sent to commercial labs, but we are getting those tests back within 2 or 3 days for the most part.
Okay, and Donald writes in with 2 good questions. One of them is Contra Costa County conducting community testing? In other words, it's not about individuals stepping forward. It's about your work to determine infection rates and other important data. That's his first question. Let me have you answer that one, and I'll give you his next one.
Yeah, up until recently, we haven't had enough testing capacity to be able to embark on that. But we're working on trying to partner with some of our local research institutions, educational institutions, to develop some community screening protocols, so we can hopefully be doing some kind of random community testing to get a better sense of how much virus is out there in the community.
All right. His second question, I've heard this from others. He says, can we expect public lockdowns to be imposed in the future whenever there is a bad flu season? So as we head into the fall, where the flu season starts again, is that really going to make a difference in looking at COVID-19 circumstances versus the typical influenza?
This virus is so much more deadly than a typical flu season. We know we've seen, really in essentially 2 months, the months of March and April, where we've really seen that since the first case were detected in this country, there's been over 56,000 deaths in this country, which is equal to the number of deaths of all Americans in the Vietnam War, which was a war that spanned over 10 years. So that number of deaths in 2 months, and it's already exceeding a typical death rate for the entire flu season, which typically runs, from November into April or May. So, 8 or 9 month season, we've already seen these number of deaths in 2 months, and that's we know certainly could have been a lot worse if we did not put these shelter in place. So that's why even with a severe flu season like we had back with the H1N1 many years ago, what people called the swine flu, we didn't take these severe steps. But because the mortality is so much higher, we didn't see hospitals running out of ventilators like they were threatening to do in New York City with influenza, but we do see it with coronavirus. So it's really a whole different scale of lethality that we're dealing with this virus, and that's why we're doing this now, and we don't do it for a typical flu season, even recognizing flu does cause many deaths. The other thing that's unique about this virus is that we don't have a vaccine, and we don't have medications to treat it.
Dr. Farnetano, Jim writes in with a question that a number of also have written in about seniors, those over 65, and what we're doing to take care of them. Now, obviously, the shelter in place has been focused on the vulnerable, the elderly, but is any of the testing that's being created going to be done in a way that can bring the test to the seniors? We have Rossmore, a huge retirement community in Walnut Creek. Anything special being done to make it easier for seniors to see what their circumstances are with testing?
We are, working with some senior living institutions, and when there's cases where there have been, cases in those living facilities, whether nursing homes or assisted living facilities, we have done testing of the staff and of the residents of those facilities. We are also looking to, expand that testing, looking at creating more community sites so that it's easier for individuals to get access to the testing. So we're looking at sites in the south part of the county, so that every region of the county has access to the sites. We're also really working closely with our private healthcare partners, especially the large systems like John Muir and Kaiser and Sutter, so that they have expanded their testing capabilities as well. So we're trying to make it easier so that anybody with symptoms can get tests, and those high-risk asymptomatic individuals can get tests as well.
Okay, and I know that there are many people listening who are from Alameda County. we will continue to get them on the horn and get their answers to these same questions for Alameda County and all these different areas in which we're discussing these metrics and how the progress is being made in Alameda County as well. There's been restricted access for visitors to senior living, assisted living communities. Any changes in that from the orders today or in the future?
No changes yet, and that is a hardship because we know isolation is a challenge. But at this point, those facilities and those residents are at the highest risk, and we've seen, across the country, as well as in our local counties, that seniors in assisted living facilities and nursing homes have some of the highest mortality and make up a large proportion of the deaths throughout the Bay Area and throughout the country. And so we really need these steps to protect them. A lot of these facilities are using video chat and Zoom and other type of video techniques for their families to still be able to visit virtually with their loved ones. But until we have these other things in place and we can more effectively protect those most vulnerable seniors, the in-person visiting really needs to be limited or not allowed to happen except in extreme circumstances.
Yeah, it's a terribly difficult circumstance, as we discussed in our town hall earlier this week. Doctor, you've been so kind with your time. Supervisor Anderson, I'm getting so many questions in. Can I just have a couple more minutes to ask a few more? Doctor, do you have a few more minutes? Okay.
Yeah, I've got a couple minutes.
Okay. So Kathy writes in, Susan writes in, very similar about farming, pick seasons starting. Some indication that that's okay to do if physical distancing is allowed for our wonderful farmers in Brentwood and Oakley. Is that right, that they can have these pick seasons if they practice physical distancing, or no? There's still some concerns.
Well, farming is certainly an activity that is allowed, and so if there is social distancing, I don't think there's anything in the order that prohibits it. I would want to make sure that there's plenty of precautions taken, that people can do it with adequate social distancing.
Question from Angry.
Okay, Candace, I think you have some background noise there on your phone.
The email.
Let me ask you.
Me. That's not me. I'm hearing that, and I'm afraid it's your operator or someone on your staff who does not have it on mute. It's
All
not
right.
me.
Sorry about that. Sorry about that side noise.
Not on my side either.
Okay. Can you estimate, here's a question from Larissa, can you estimate when small business such as hair and massage salons can reopen?
It's hard to give any precise dates. I know there's a concern there. A lot of folks really would like to get their hair done or get a haircut, but those activities are very high risk because they involve people in very close contact, very, very close to each other. And there's also, in order to do it safely, it's probably going to require, use of masks and face shields and other kind of personal protective equipment that there's been a real shortage, and we've needed to keep those for the healthcare workers. So I'm hoping at some point in the future we'll be able to resume those type of activities. But we are looking at the data and these metrics on a week by week and day by day pace, and hoping we can get there. But I don't want to promise any specific time frame.
Well, let me finish then with a question that I've gotten so much here about the small business owners, the little retail shops, whether it's the flower store, the shoe store, or so many different wonderful vendors in our community. They say you can go into a big store like a Target or a Walmart and get the same stuff that they have, and they're allowed to do that. But their little corner store, where they can regulate how many people go into, that they feel like that these orders don't allow, as I understand it, that the revised order that you're talking about today still doesn't allow for those small shops to be able to sell their wares. Can you talk about that going forward, what you see?
Yeah, and the orders are based on the types of wares that are sold by the different vendors. They don't necessarily discriminate against the size of the business, but there's some businesses, because they sell some essential products, are allowed to sell some other non-essential products alongside. But that those indoor shops, hopefully, in the future, as if the trends continue to improve, we'll hopefully be able to get to a point where those businesses can reopen and have protocols where they can operate safely in the near future.
Well, Dr. Farnantano, you have been so gracious with your time, and Supervisor Anderson, the same with you. You guys are doing great work. I know there's frustration out there. We all feel it. We feel that we've been sheltering for 40-plus days, and we're doing our best. As a community, we're doing our best, that we're seeing progress, and yet this is still very difficult to go through. Maybe in your final comment, you can speak to that. Supervisor Anderson, thank you for being a part of this conversation. Any final thoughts?
Well, first I want to thank you, Steve, because you have been such a great support of our county, Alameda County, in ensuring that we have what state resources we need. But also you have been such a great vehicle with these town halls to get information out to the public. And I always make sure I have someone on my staff on your calls because you've got such great information. I also really want to thank our community, our public, for their tremendous cooperation. It has just been outstanding to see people looking out for one another, helping one another, and complying with these orders. And it's hard. It's very hard. Dr. Farnantano won't bring it up, but he had to watch his son's wedding on Tuesday on a Facebook Live rather than being in person with his son for his wedding. And many of us have celebrated our grandchildren's birthdays from a car, watching them open gifts from a driveway, which is what I did 2 weeks away. People are making personal sacrifices. They're making financial sacrifices. But what we've done is now it's not the time to let up. We don't want to lose the progress we've really achieved. And if we lift restrictions too quickly, it could lead to a surge in cases and result in some very much avoidable hospitalizations and deaths. And so I want to thank people for hanging in there. I know it's hard, but it is for the greater good of all of us. We're relying on science, not politics, as we get through this.
Thank you very much, Supervisor Anderson. Thank you again for your terrific leadership. Dr. Farnantano, boy, I bet you never knew the year was going to be the way it has been. Do you get a restful moment out there to get a breather and recover? How would you sum it up for you personally and professionally?
Well, it's been certainly a challenge. It's been many long days, and we joke about how weekends don't exist anymore because it seems like one day rolls into the next. But I think that folks look to the Bay Area as an example of an area of the country that really did things right. We sheltered in place early before the surge. And it's really the public who followed the direction and did their part and stayed at home as much as possible. And the results we've seen here, even though we now know that the Bay Area was really one of the first places that this virus started, and we had the first death. And even though it started here first, we were able to prevent a terrible surge that some other parts of the country have had. But it's sort of like we're in the eye of the hurricane, and the storm is still raging all around us. And so now is not the time to take the shutters off the windows. We still have to really be prepared and ease up slowly, step by step, and make sure we don't ease up too quickly and lead to another surge.
Well, of course you're right, and I thank you for the vision that you and your public health officers had to take that courageous step more than 44 days ago, to set our first order in place. And we can clearly see that the Bay Area has reduced substantially the number of hospitalizations and deaths because of your enlightened and courageous leadership. So we're very, very appreciative. So friends, I thank you for tuning in to this 15th version of our coronavirus town hall. We're going to continue to bring in experts who are on the front lines making these decisions, those who have great helpful tips about how we can cope, how we can ensure that the health and safety of our community is in place as we endure the difficult days and weeks that are still ahead. If you'd like to listen to a recording of this conversation, it's going to be on my website in just a few minutes. That's sd07.senate.ca.gov. We also have on that website the latest information from the Center for Disease Control, the county public health departments who we're talking to today, the Office of Education, the state, and many other great resources that could help you in your life. I acknowledge again the difficult situation that each of you are facing at home, and but we have made progress, and I'm encouraged that in the news that we heard today, that we just have to keep it going and hold the line, and we can have a better future going forward. So I have these town halls to bring you that reliable, up-to-the-minute information. If you have suggestions on topics that you'd like to see covered next week, please be sure to send me a note. I appreciate it very much. Thank you so very much for tuning in, and have a great rest of your day. Thank you, everybody.